We are going to look at the named bodies in various diseases. So the first question is, where is the Leishman-Donovan body seen? Next question, where is the Cowdray type B body seen? Next, where is the Howell Jolly bodies? Where are they seen? So we'll find the answers to these questions and learn a lot more. So the first one is the asteroid bodies. So the asteroid bodies, they are seen in cases of the sarcoidosis as well as the sporotrichosis. Next, we look at the Hall Burstetter Provazek bodies. So they are seen in case of the trachoma. Next, we look at the Miyagawa. So the Miyagawa bodies, it is seen in case of the lymphogranuloma venerum. Next, we look at the Leventhal Coley Lilly bodies. So Leventhal Coley Lilly bodies is seen in the psittacosis. Next, looking at the Leishman-Donovan bodies. Leishman-Donovan bodies is seen in case of the Kala Azar. Next, we look at the Negri bodies. So we look at the Negri bodies. So the Negri bodies are seen in case of the rabies. Next, the Guarnieri bodies. So where are the Guarnieri bodies seen? It is seen in case of the vaccinia. Then the Bollinger bodies. The Bollinger bodies are seen in case of the fowl pox. Then the Henderson-Patterson bodies, HP bodies. Henderson-Patterson is seen in case of the molluscum contagiosum. Then looking at the Cowdray. So Cowdray, there is a type A and B, not to be confused. So A, it stands for the yellow fever as well as the herpes virus infection. Now B, it goes for the adenovirus as well as the polio virus. Then we look at the Russell bodies. So Russell bodies is for the multiple myeloma. Next, we look at the Aschoff bodies. So the Aschoff bodies are seen in case of the rheumatic fever. And next, the Kohl-Exner. The Kohl-Exner bodies, they are seen in the granulosa cell tumor of the ovary. Then looking at the Kivet bodies. So they are nothing but the colloid bodies. So they are seen in case of the lichen planus. Then looking at the Michaelis-Guttman bodies. So the Michaelis-Guttman bodies, they are seen in case of the malakoplakia. Then looking at the Lewy bodies, they are seen in case of the Parkinson's disease. Then looking at the Pappenheimer bodies. The Pappenheimer bodies, they are seen in case of the non-heme iron pigments, and this is of the siderocytes. Now moving on, looking at the holly jolly bodies. Howell jolly bodies. So the Howell jolly bodies, it is seen in case of the splenectomy, the megaloblastic anemia, as well as the hemolytic anemia. Next, looking at the Hens bodies. The Hens bodies, they are seen in G6PD deficiency. Now looking at the gamma Gandhi. So gamma Gandhi bodies, they are seen in case of the congestive splenomegaly. Next, in case of the Mallory bodies. So the Mallory bodies, they are seen in case of the hyaline inclusions. And this is seen in case of the hepatocytes. And they are seen in case of the alcoholic cirrhosis as well as the Indian childhood cirrhosis. Next, we look at the councilman bodies. So councilman bodies, they are seen in case of the acute viral hepatitis. Next, we look at the Samoma bodies. The Samoma bodies, they are seen in case of the dystrophic calcification of the meningioma. Next, the papillary serous cyst adenoma, and this is of the ovary, and the papillary carcinoma of the thyroid, then the papillary type of the renal cell carcinoma. Next, looking at the Donovan bodies. So the Donovan bodies, they are seen in case of the granuloma inguinale. Next, looking at the Nissel's granules. The Nissel's bodies, they are seen in case of the cytoplasmic inclusion of the neurons. Then looking at Mooser's bodies, the Mooser bodies. So the Mooser bodies is seen in case of the typhus fever. And looking at the Crayola bodies, Crayola is seen in case of the asthma. Then the Verroque bodies. The Verroque bodies are seen in case of the schwannoma. Next, the Scilla-Duval bodies. The Scilla-Duval bodies are seen in case of the endodermal sinus tumor. Then the Hirano. The Hirano bodies, they are seen in case of the Alzheimer's disease. Next is the ferruginous bodies. The ferruginous bodies are seen in case of the asbestosis. So now answering the questions we asked. So the first question we asked was, where is the Leishman-Donovan body seen? So the Leishman-Donovan bodies, they are seen in the Kala Azar. The next question was, where is the Cowdry type B seen? So this is seen in case of the adenovirus as well as the polio virus. The next question, lastly, this was the Howell-Jolly bodies. The Howell-Jolly bodies is seen in case of the splenectomy, the megaloblastic anemia, as well as the hemolytic anemia. This is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.